Hello and welcome to Sick Notes. My name's Ed Hope. I'm a junior doctor in the UK, and it's a long-running joke that doctors' handwriting is really difficult to read, but being a doctor myself, it should be straightforward, right? Well, let's give it a go. So I've Googled a bunch of doctors' notes that I think people have uploaded because they've got such mad handwriting. So let's see how we get on. So the R with a line through here means treatment. So the patient's going to be on codeine, so a mild opiate. That's a pain relief. Goodness knows what that is. It almost looks like it says Insta. Follow the doctor on Instagram. Again, what does that mean? 30 in Roman numerals? This looks mad. Maybe that says 5 milligrams out every number of hours. So 5 milligrams once every 4 hours. Okay, we're getting there. Normally when your colleagues give you difficult notes to read, there's something you can tag on to. I've never again seen anything this crazy. Thankfully, I think this is like an old prescription, like proper old. Does that say 1942? Blimey. So yeah, you couldn't get away with writing that nowadays, thank goodness. Okay, I've seen this one before. Apparently that says paracetamol. In medicine, we call this flatlining. It's where your writing turns into asystole and, you need to start CPR and give some adrenaline. This would never be legal on a drug chart for obvious reasons, but we have to write in capitals on a drug chart, and obviously the people giving the medication, so the nurses and the pharmacists, would have to sign off on it as well. So even if the doctor was stupid enough to put that on, it would never get through the other safety checks. The caption to this one is, you may not be able to read a doctor's handwriting, but the bills, always neatly typed. Not so pertinent in the UK, although we do have lots of people that have private healthcare as well. But this looks like a plan for someone's medical treatment. We often write it in a numbered list so that we can tick off the things as we're doing them. Number 1. Some drug beginning with P, 40 milligrams PO, so that means to be taken orally, so rather than injected or anything like that. But they've crossed out IV, so they did want it to be injected, but now they've switched it to oral. And they're saying stat, so they need to give the 40 milligrams oral straight away, but quite what? I wonder if that's prednisolone actually. Yes, okay, so number 2 says asthma, I think. So I think this is a treatment for someone with an asthma attack. It says asthma, but then what does that say? Number 3, peak flow to baseline, I think. The asthma is an obstructive lung disease, so all the airways become narrowed. That's why you get that classic wheezing. So one of the things we like to do to find out how bad the asthma is a peak flow. So if you imagine if the airways are obstructed, we can get less air through those airways. So that's what we're monitoring. Number 4 here looks like it says NEBS every 4 hourly, and that probably says Atrovent, so ipratropium, one of the drugs we give. So a nebulizer is a drug we give via a mask, and Atrovent and salbutamol are both drugs. I think that's what it says here, but that's certainly what you'd give in an asthma attack. 75% of, I don't know, but I know what it's supposed to say because the guidelines for asthma is if a patient's peak flow can return to 75% of their normal reading within an hour of treatment, then they can be safely discharged unless there's any other things that need to be kept in. So I see asthma a lot in the emergency department, and it can be really scary actually. We get used to people having quite mild asthma around us, but when people have it severe, it can be life-threatening. So the first thing I'd do is I'd write the diagnosis nice and clear at the top, which is probably missed out from these notes the way it's been cut out. So I'd put the diagnosis and the severity of it, and there's certain criteria that I'd write to say which severity I've scored it at. In my list, I'd put number 1, peak flow, and the time. It also helps us to score the severity as well. Number 2, I'd put rule out any underlying cause, because there are other reasons why an asthma attack may be exacerbated, for example, like an infection. So I'd do blood tests and a chest x-ray. Then after, I'd then put the management, and I remember it as an Irish guy called OSIP, so oxygen, salbutamol, ipratropium, and prednisolone, so a steroid, or sometimes we use hydrocortisone. Lots of doctors hearing that will think your management plan is in the wrong order, but I just like to structure my notes in the same way every time. So I always like to put bedside tests, then investigations, and then my management plan. So in essence, before I did any of the blood tests or chest x-ray, the patient needs to have that treatment first. What the hell? What could be worse than the handwriting of a doctor? Handwriting of a Chinese doctor. Is that real? Well, I mean, it doesn't help that I can't read Chinese, but that looks mad. I wouldn't like to be the nurse or pharmacist following that plan. So it looks from our little bit of research here that the belief that doctors' handwriting is bad is probably true, but as doctors, we love our research. And there's quite an old article from the British Medical Journal back in 1996 that compared the handwriting under time pressure of different health professionals, found that actually doctors' handwriting was as good, or should I say as bad, as everyone else's. One possible explanation is that average is in absolute terms bad, and that the poor handwriting of doctors is riskier than the poor handwriting of non-doctors, which I completely agree with. It's far more devastating for me to write an illegible prescription than it was for me to write an illegible strap line when I worked in advertising. And I'd also say that to the layman, many medical terminology, like the names of symptoms and diseases and drug names, are words that they would just not encounter. So it's even more difficult to recognize them through poor handwriting. And a further publication on medical record keeping in the British Medical Journal in 2014 puts forward some other reasons. For example, that medical record keeping is seen as a low priority, which I totally get, particularly as a junior. Sometimes there are pressures to write quickly on a fast moving ward round, or you might not know exactly the things that your consultant wants you to document, or even just being in a really tight patient bed space and not having like the physical space to be able to write easily. And in the emergency department, I'm frequently interrupted in my medical record keeping to deal with a sick patient, and then you have to come back, and so the information just isn't fresh in your mind. The publication goes on to suggest that there being no standard model for documentation is also an issue, and that is highlighted by the doctor's notes we looked at earlier, right? And also the medical puzzles I've put on this channel, which highlight the number of abbreviations we can encounter in the medical field. For example, the abbreviation OD, I said, could be used to mean a drug to be taken once a day. And in the UK, that is the abbreviation used in the British National Formulary. However, this abbreviation is forbidden in many other parts of the world, as it can be confused with oculus dexter, meaning drug to be given in the right eye. Also, OD can commonly be used to represent an overdose. So although I use these abbreviations in my little medical quizzes to help people try and decode what they're reading, I by no means endorse medical professionals to use them unless that's a commonly understood term in your teams. The General Medical Council, who license doctors in the UK, are clear on what is expected of doctors, and it comes to no surprise. Keep clear, accurate, and legible records, so no dodgy handwriting. Make records at the time the events happen or as soon as possible afterwards. So they're recognizing that in some cases when we're at emergencies, they can't happen straight away. And this is expanded upon by the Medical Defence Union, who often have to defend doctors against litigation. And they give these tips, including write legibly and avoid abbreviations. So there you go. As doctors, we're quite happy to have the mickey taken out of us for our handwriting, but in reality, we should be doing everything we can as doctors not to live up to that particular reputation. So it just leaves me to say thank you so much for watching this video. I hope you've learned something from it. If you did, check out some of the other videos, and why don't you consider subscribing as well. So until next time, take care of yourselves, and I'll see you soon.